Hello, this is Dr. Molly Weis. I'm an orthopedic surgeon here at Good Samaritan, and this is Good Samaritan Spotlight, your questions answered. So I have some questions to answer today. Question 1 is, what is a fracture? So you'll hear a lot of people talk about fractures, and sometimes a person may say, I broke my bone, I have a crack in my bone, I have fractured my bone. All of those are the same things. Those words are synonymous. So no difference between breaking or fracturing. They're all the same thing that happens to the bone. And what occurs is the forces or the stresses that are being placed upon that bone may be too much for the bone to support. And so we have a real strong outer cortex, this layer of our bone, and sometimes the force is just too much. And then the bone, something has to give, and so sometimes that is the bone, and it will break. It can break in multiple places. Those areas that where it breaks, that will determine what kind of treatment you may need. But ultimately, when stresses become too much for the bone to support, that's when you end up with a fracture. All right, question number 2. How do I know if my bone is broken or just sprained? Well, it can be difficult sometimes to know if you have a break or where it's not broken, but maybe you have a tendon injury or a ligamentous injury. More often than not, when a person experiences a broken bone, you may get a nauseated feeling. That might be the first signal that something bad has happened to the bone that's been injured. Not everyone experiences that though, but that is one thing. If your child comes to you and tells you they felt real sick to their stomach after they got tripped up on the trampoline, you might want to take them to be evaluated. And how do you know if it's broken or not? You really need an evaluation either by your primary care provider. You could always call and make an appointment with any of the orthopedic surgeons here in town, or we have our convenient care, even emergency department. But ultimately, to have a healthcare professional look at the extremity that's been injured. A good physical exam is always the start, and then x-rays. The x-rays do give us a lot of information. Now, there are times when an x-ray does not pick up a broken bone on an acutely injured extremity, and if pain persists, it's always a good idea to go back a week later so get that follow-up x-ray, because sometimes then you do see it on that follow-up x-ray. There are other imaging studies we use. Sometimes a CT scan can be helpful. A bone scan can alert us to injury to a bone, but an MRI is something that we may get to really show. That gives a lot of information about the bone and the soft tissues. An MRI will pick up a fracture acutely, and so sometimes that's what we need to order. Question 3, when should I go to the emergency room for a possible fracture? And that's a hard question to answer, and some of it depends on the pain. If you have pain that cannot be controlled, then sometimes to go into the emergency department, because the providers there certainly can help you get that pain under control and maybe to splint the extremity. But if it's a Saturday night and something has happened and your child or you have an injury, if there's obvious deformity to the limb, I would go into the emergency department. If you develop numbness, tingling, cold sensation in your extremity, those would be reasons to go to the emergency department. If you aren't experiencing those and you suspect maybe there's a bony injury, if you have a splint or to be able to mobilize that extremity, get the person comfortable. Those are injuries that are okay to wait till Monday. But no one would ever fault you for going to the emergency room to have an extremity evaluated if you were concerned about possible fracture or injury. Number 4, do all broken bones require surgery? No, not all broken bones require surgery. There are certain parameters that we look at with injuries, and we use the x-rays to help us with that. If there's a certain amount of angulation or displacement, then that may put you more towards the side of needing an operation or some type of procedure. Sometimes it's a closed reduction is all you need. We see that frequently with children where maybe there's some angulation of a wrist fracture, and so we want to try and get that lined up better. Then we just, with the help of anesthesia, we make the patient comfortable. We can reduce it and put a cast on that. Oftentimes for adult injuries, the displacement is usually a little bit more, may go into the joint surface, And in those types of injuries, then an open reduction internal fixation might be something that is offered. And that just means we're making an incision, getting the fracture reduced, putting a plate and screws on there. Maybe you've heard of people getting rods or nails placed into bones. Ultimately, the surgical fixation is using some type of hardware to really stabilize that bone, stabilize it internally, where with children we can use a cast to try to do that. For adults, it doesn't always work out so well, so we use the surgical approach. Question number 5, how long does a broken bone take to heal? There can be some variability in that, but typically it takes about 6 weeks for a broken bone to heal completely. Now, to get as strong as it once was, you might need another 4 to 6 weeks for it to be as strong and to be able to take the same types of forces that your uninjured extremity could do. And the variability, children generally heal a little faster than adults. And the younger you are, when sometimes an injury may happen when a child is being born, sometimes a clavicle fracture, those little ones can heal that in a few weeks. And it's pretty amazing to see how quickly they will heal. Typically with children, probably 4 to 6 weeks to heal the bone, and then that additional time to get it stronger so they can return to whether it's baseball, soccer, any type of sport they want to do. And sometimes your provider may say, hey, we're going to keep them in a splint till we hit that 8 or 10 week mark. And that's just to protect that bone while it's healing. Same thing for an adult, about 6 weeks, but you take a femur, that might take a little bit longer, and then you add that additional time for it to get nice and mature like it once was. There are times, though, where a fracture may not heal. Some fractures will go on to a non-union, is what we call that. And how to predict that or know when that's going to happen, that's difficult to say. A non-union, sometimes it's just going to be what that fracture was going to do, and maybe it's as much bad luck as it is anything. X-rays taken periodically during your healing process, that helps the physician or the provider know that you are making new bone and you are healing that. So it is real important to keep your follow-up appointments as you're healing. All right, question number 6. Can you walk on a broken foot or ankle? And so the answer, can you walk? Yes, you can walk, but sometimes you shouldn't be walking. So despite having a broken bone, you can still ambulate, you can still walk. Now, oftentimes when a person has that, you'll see them limping. If you're in that situation, you don't want to just ignore that, to go get that evaluated and looked at. Well, once you get identified as having a fracture, then you need to listen to what your provider is telling you. There are some types of fractures about the foot or ankle where we might say, hey, we're going to put a boot on that, have you use your crutches, and you can put some weight through the foot or ankle. There are other types of fractures, maybe where it's a broken ankle and you've had surgery where we're fixing both the inside and the outside parts of the ankle. Most typically, your surgeon would probably tell you don't walk on that until there's some healing happening. So to say, can you? You can, but should you? Maybe not all the time. Definitely listen to what your provider is telling you. Question number 7. What happens if a fracture doesn't heal properly? Well, so as we talked about previously, that you can go on to develop a non-union if a fracture is not healing, and we're watching x-rays, and after about, usually at 6 months, you might call something a non-union. If you go down that path, that's not an injury you want to just let go. If you have a non-union with an ankle fracture, that could lead to prolonged pain, or pain forever, really. You may get arthritis at a much younger age, and then it's going to affect your ability to walk. It's going to affect your daily activities. And so if you are identified as someone that has a fracture not healing properly, your surgeon may suggest a second surgery, or if you haven't had a surgery, maybe that you're going to need a surgery, where what we would do is go to where that fracture is, and then most likely bone graft around that area and then stabilize it with some hardware. Sometimes a fracture may not heal in the proper alignment. That would be another way that a fracture may not heal properly. If there's more angulation or displacement than what we'd want to see with your fracture at, let's say, 3 weeks or 6 weeks from the injury, your surgeon may suggest a second procedure to realign that bone and get it back where it needs to be. Because ultimately, the goal with the surgery is, whether it's right after your injury or if it's a few weeks or several weeks after the injury, the goal is to realign that bone into its proper anatomic position to give you the best chance at a good outcome. And what's difficult with that is sometimes we fix a bone and it may look perfect on that x-ray, but 10 weeks, 12 weeks afterwards, a patient may still have pain. They may still have limited range of motion and may have some difficulty with that extremity. Someone asked me once what was the hardest thing, or what was one thing I didn't love about orthopedics, and I answered trauma. And it wasn't so much that I don't like to take care of trauma, it's the fact that that trauma changes your life right at that moment. And we try as best we can to get you back to where you were, but the fact of the matter is not everyone gets back to 100%. So the importance of getting that fracture treated properly in the early stages, or when we see something isn't going quite right, that's really important for your outcome over the long term. All right, question number 8. Is it normal to have pain weeks after a fracture? I would say it not everyone may feel that, but it's not unusual either. The hope would be for a typical fracture, let's say if you had a wrist injury, a distal radius fracture, it's going to be pretty painful at the time of the injury. I would usually see you in the office sometime within that first week, and let's say maybe we see you at 1 week after the injury. You're probably still going to have a fair amount of pain, where patients will rate that pain probably anywhere from a 6 to a 10 on a scale from 1 to 10. So at 1 week, not too unusual. We would want to make sure you're in a splint that's comfortable. We would have you limit how much you're going to use that extremity, limit how much you lift through that extremity. Sometimes needing some pain medication is pretty typical at that time, but the hope would be over the next 2 to 3 to 4 weeks that maybe you're able to just manage your pain with Tylenol or one of the nonsteroidal anti-inflammatories. Once you get to about 6 weeks, the hope would be you have pretty much no pain. Now, as you start to use it and maybe work through some therapy, you might have a little pain at that point, but that would be dependent on what you're doing. At 6 weeks or so after an injury, I would hope you would not have constant pain. The pain, like I said, getting your stiffness to work out, getting used to using it again, that may be there for a few weeks, but I would hope by week 10, 11, or 12, that maybe at that point there is no pain and you're back to using that extremity or that whichever injured bone you have, able to get back to normal activities with no pain. Question number 9. Will I need physical therapy after a broken bone? I would, that's sort of subjective, I would say. With our children, typically they don't need therapy. Kids seem to bounce back from injuries pretty well. But that being said, every once in a while, the pediatric population may need some therapy, probably more common with elbow injuries, sometimes lower extremity injuries. As for adults, it's not unusual to need some therapy. You put an extremity in a splint or say you can't use it for that 6-week time period, and your joints will get pretty stiff. It's not real easy just to jump right back into life. Sometimes it may be that your provider will prescribe a home exercise program where you go and see the therapist just one time and they give you some exercises to work on at home, and then you can work through those and get yourself back to where you need to be. There are times when we do order the therapy and you go to the therapist where you might go a couple times a week for the first 4 weeks or so, and then maybe once a week after that. The therapists are definitely very helpful in getting you back to your daily routine and using that extremity the way you need to. But like I said, it's kind of dependent upon the person, also on the injury. But it is not unusual to need a little bit or a lot of therapy when you're recovering from a broken bone. Question 10, how can I prevent future fractures? Well, I would say sometimes it's hard to prevent fractures. Most of them happen, they're accidents, and that's just what accidents are. If we could prevent all of those, then that's what we would do. But just by virtue of the activities we do through a day, you step off a curb and you can roll your ankle. Your dog hits you and you lose your balance. You land and you on an outstretched hand, you break your wrist. And so short of not doing anything, which that's not living, fractures are going to happen. There are some times where maybe a person has a vitamin D deficiency, or maybe calcium levels are off. Maybe you don't consume a lot of foods with calcium. And it's hard if a person doesn't really like dairy products or dairy products don't agree with you. A lot of patients will think that's the only way to get calcium, but there are many other foods that are rich in calcium. And if you have a pretty well-balanced diet, then you're probably getting that calcium. Now, if you say, well, I know my 12-year-old doesn't have a well-balanced diet, then to get those supplements and take the calcium with vitamin D, those are real important. But I'd say it's rare that a person comes in to see us and they have a fracture because of vitamin deficiency. Now, they do happen, and there are those who do have things like that. But the majority of patients with fractures, it's because you've fallen and the bone just breaks. You could fall 99 times that way and never injure anything, and then you get that one time, and then you have a broken bone. So while it would be nice to be able to prevent fractures of all kinds, they're just going to happen, and that's part of being human. Those are all the questions that we have for today. I'm Dr. Molly Weis. If we can ever help you, please notify our office. Thank you so much for watching.